The federal government has approved the disbursement of 32.9 billion naira under the Basic Healthcare Provision Fund for the fourth quarter of 2025, with payments scheduled to commence in January 2026 in line with the BHCPF 2.0 guidelines. The approval was granted at the 13th Expanded Ministerial Oversight Committee meeting of the Federal Ministry of Health and Social Welfare, chaired by the Coordinating Minister of Health and Social Welfare Professor Mohammed Ali Pati, alongside the Minister of State for Health, Dr. Isaac Adegunle Salako. Speaking at the meeting, the Permanent Secretary Daju Kachalom underscored improved collaboration across federal, state, and local governments, noting the inclusion of civil society organizations and Association of Local Governments of Nigeria and the MOC to strengthen primary health care delivery nationwide.
So it's more inclusive, but note that we're working together. The health sector is one, so we're working in synergy, federal, state, and local government. So there's no demarcation. We work together for the good of Nigeria to save lives. And for the NHIA, insurance coverage has increased, and I'm sure we're looking towards the next quarter, first quarter of 2026, that more will be done in the area of insurance coverage. And I want to assure all of us seated here, the civil society, Nigerians, the media, that what you will see in 2026 will be much better than what you saw in the last 2 years, because we are working together. And as my colleagues have said, accountability, transparency is what we are giving to Nigerians under the health sector. And under the renewed hope agenda of Mr. President that holds the health sector as one of the very key and important mandates of his administration, I'm sure you will all agree that you've seen a great transformation. Health sector is not tangible. The things in health are not things you can count. They are intangible things, but you can feel them. And we assure you, under the coordination.
Executive Director of the National Primary Healthcare Development Agency, Dr. Muyiwa Aino, described the approval as the fourth consistent quarterly disbursement in 2025, reflecting strengthened accountability and better service delivery.
In today's MOC, the MOC approved the disbursement of the fourth quarter disbursement of 32 billion plus to go to all of the 36 states plus the FCT. This is the fourth disbursement this year, and again is in fulfillment of the commitment of the MOC to regularize these meetings and regularize the disbursements. I think we noted a number of things as well. We noted improvements in service delivery, improvements in insurance coverage, improvements in NEMTC. Basically, all of the gateways are making progress. I think one of the observations today was that we have now established the rhythm. We have now established the direction and the strategy, and the focus in 2026 as a sector will be to accelerate impact, building on some of the foundations that we have currently built.
While Director General of the NHIA, Dr. Kelechi Ohiri, highlighted increased transparency and citizen oversight.
Transparency in terms of publishing how much is being transferred from the 1% consolidated revenue to the state and the local governments, and ensuring that Nigerians are aware of what the federal government is doing and money that is being channeled. The second thing is accountability, which is where each gateway is here and being held accountable to say, what have we done with the resources we have, and not just through BHCPF, but also other resources. So this is the fourth meeting this year, and quarterly we come back to say what we have done. I think that is the spirit of the MOC that we should continue. And we're being held accountable not just by ourselves in government, but from our partners and also from Nigerians represented through civil society and through the media.
The ministry pledged to deepen reforms and expand health insurance coverage in 2026, reaffirming BHCPF's role role as Nigeria's flagship mechanism for sustainable primary healthcare financing, especially for the poor and vulnerable. Comfort Olayinka, Alpha TV Network.